Hi, I'm Dr. Mike Zachek, and I've been at the Gilbert Clinic since 1986. So we've discussed the results of your sleep study, and we found that you have significant sleep apnea. We're going to try a CPAP device in you, and I think you need to understand in greater detail what CPAP is, how it works, and how effective it can be. CPAP is really nothing more than a simple compressor. You know, if you went to the garage and found your tire was flat, you get the compressor out and fill the tire up. If we have a flat tire and it's in the back of the throat, we just need to put enough air in the back of the throat to keep these delicate structures from touching, and that keeps us from snoring and having interruptions to sleep because of breathing problems. Now, the way our new fancy CPAP compressors work is they do everything automatically, and we as doctors and you as a patient will sit back and watch. They start with a pressure that's barely above the pressure in the room, and the machines actually watch you breathe. When your breathing stumbles, the machines turn the pressure up little by little until we get to an ideal pressure. The way I configure these machines is they watch you for the first 7 nights, learning you and adapting to you, and on the 8th night, this machine sets what it thinks is the right pressure in the machine. But it's not done because it's a smart machine. Thereafter, it continues to watch you, and every 30 hours of use, this machine adjusts the pressure little by little. Now, most of my patients have smartphones, and these machines can talk to a free app on your smartphone, and they can learn how they're doing. The app on the smartphone will give 3 important pieces of information: breathing disturbances per hour, hours of use, and most importantly, how well what you wear fits. In order to keep the air in the back of your throat, to keep your throat open, you have to wear something. You have 4 basic styles of things to wear: something that goes under the nose, something that goes over the nose, something that covers nose and mouth, or something that goes under the nose and covers the mouth. But that would be like going to the shoe store and getting loafers, boots, sneakers, or sandals. If you chose sneakers, you're not done. You still have to choose Nike, Reebok, New Balance, sizes, and materials. The object here is to find something you like. As long as the app tells you that the mask fit is good, I'm happy. If you like it and I like it, we're in good shape. On the machine, there's a couple of bells and whistles. There's a knob that adjusts the amount of moisture. Now, in Kentucky in the summer, we don't need a lot of moisture, but when the house dries out in the winter, when the heat's been on, you might need a little extra moisture. Think about that knob on the machine like the thermostat on your wall. You adjust it according to the seasons. So when you go to the store to get your CPAP machine, make sure you learn how to use that knob to adjust the humidity. There's only 2 buttons on the machine. The first is the on-off button. The second is a triangle button. We call it the ramp button. And what that button does is it lowers the pressure and then lets it ramp up. It won't be terribly important for the first 7 nights because the machine always starts at the lowest pressure. But on the 8th night, when this machine sets the pressure, that ramp button can be handy. If the pressure seems too strong, use that button as much as you want. One other feature of the brand new CPAP machines is that we can remotely address your problems. I had a trucker the other day that called me up from Florida. He said, "Doc, I'm struggling with my pressure. What can I do?" I went in on my laptop here in Bowling Green to his machine, discovered what the problem was, sent a message to his machine, and fixed it right then. So we encourage our patients, if they're struggling with problems with the pressure, to call us here at the office. It saves them a visit, and it gets them on therapy quicker.